أعزائي المشاهدين، مساء الخير وتحية طيبة ولقاء طبي آخر وطبيب على الهواء. وضيفنا اليوم الدكتور عبدالله براون، المدير الطبي لمركز مغربي بالمدينة المنورة، وهو أيضا استشاري في جراحات المياه البيضاء والمياه الزرقاء وجراحات الليسك. تكلمنا مع الدكتور عبدالله في حلقة سابقة عن موضوع جراحات قصر النظر والليسك والليزر، وناقشنا بعض الجوانب التقنية المتعلقة بهذا النمط الجراحي. النهاردة هتكلم عن موضوع آخر هيهم الكثيرين الحقيقة، وله ارتباط وثيق بتقدم العمر، له ارتباط وثيق بإصابات العين، له ارتباط وثيق بأشعة الشمس الحارقة في فصل الصيف، وهو موضوع المياه البيضاء أو الكاتاراكتا كما تعرف مجازا أو باللغة العامية. Dr. Brown, thank you once more for being with us today.
My pleasure.
And we will be talking about a very important topic today, because I just mentioned to our viewers it has a relation to age, relation to maybe eye injuries, and it has also relation to the glaring sunshine, the cataract, المياه البيضاء أو cataract. Why it is called المياه البيضاء, and what is cataract then?
Okay, well, the reason it's called moya beta is because in the past people let the cataract go so long that the eye would turn white. And so they would call it white water. And what the cataract is that inside the eye we all have a lens, just like a glasses lens. Mm-hmm. And under the normal condition when you're young, this is clear. But when it becomes dark and hard to see through, this is cataract.
Mm-hmm. Mm-hmm. أنا سألت الدكتور عبدالله، قلت له يعني ليه بيسموها الناس المية البيضاء، أو إيه هو التعريف العلمي للكاتاراكت؟ قال له هو ببساطة إن العدسة شفافة، يعني ما فيهاش أي لون، لما العدسة دي بتعتم وتغير لونها تبقى زي اللون الأبيض، فعشان كده سموها الكاتاراكتا أو المياه، يعني هي مشكلة في شفافية العدسة. What causes cataract then? I think I've mentioned some of the reasons.
Yeah, actually, you mentioned a lot of them. The main one, of course, is age.
Yes.
In rare cases, children are born with cataracts. In some cases, it's caused by certain diseases, certain medications like steroids, trauma. But vast majority of cases, it's just age. Growing older, you get a cataract.
So, will you be able to look in somebody's eyes, to look at my eye by your naked eye and tell me, yes, you've got cataract? Or how would I know if I have cataract then?
Well, most people know just because their vision is getting worse and worse, and glasses does not correct their vision anymore. Yes. So even with glasses, their vision is getting worse and worse.
Mm-hmm. Simple as that.
That's all there is to it.
أنا سألته قلت له يعني أنت لو بصيت لي عين أي واحد بالعلم مجرد ممكن تقول إن عنده كاتاراكت أو مياه بيضاء، أو إزاي الشخص هيحس إن عنده كاتاراكت أو مياه بيضاء؟ قال لي ببساطة شديدة جدا إن نظره بيضعف تدريجيا وما بيتحسنش، وده مرتبط ارتباط وثيق بتقدم العمر مع بعض الأسباب الأخرى. طبعا هو أشار إلى الكاتاراكت أو المياه البيضاء الخلقية اللي بعض الأطفال بيتولدوا بيها نتيجة وجود متلازمات أو سندرومات معينة. Is cataract can be medically treated, or cataract means surgery?
Well, yeah, cataract means surgery.
Simple as that as well.
Oh, yeah. Everybody would love to have a medical treatment for this, but it's like trying to get one of these little freckles on your hand to go away. There's no drop to fix this. You would have to remove it. Same thing with the cataract.
Mm-hmm. And what surgery is it? Removing the cataract?
You have to actually remove the cataract, yes.
And when you remove it, you put another thing, another lens, or?
Well, we do.
Uh-huh.
A lot of other people don't. And
all right.
But yes, no. The standard of medical care in the West and the standard of medical care in the Muggerbee group is when you remove the cataract, you have to replace it with a lens that is calculated to best fit that patient, to give them the best vision possible. Mm-hmm. And that's the best that we can do.
دكتور براون بيقول علاج الكاتاراكت جراحي. أكيد الناس كلها هتحب لو كان في علاج طبي عن طريق دواء أو مراهم أو قطرات، ولكن الحل الأمثل علاج جراحي، بنشيل عتامة أو نشيل الكاتاراكتا. وقال لي إن هم في مراكز مغربي عشان عندهم خدمة متميزة وجودة نوعية، إنهم بيزرعوا مكان هذا الكاتاراكت اللي هو عدسة أخرى تناسب هذا الشخص وتعطيه أحسن مستوى في الرؤية وفي البصر. Right. Are there any different parts then of removing this cataract, or is it one straightforward, simple procedure then?
Oh, well, no, I mean, there are a couple of different ways.
Yes.
The older style involves making if this is the eye, it involves making a very large incision in the eye and then opening the eye, removing the cataract in one piece.
Yes.
It's really, for those of us who are looking at the history of eye surgery, really this is a hard way to do the cataract extraction anymore. The modern method is phacoemulsification, where we just use a probe and we just through a very small incision we just enter and remove the cataract with ultrasound, replace with a very high quality lens, usually a special lens which is normal size, but we can fold it to place it inside the eye. And the difference between the two kinds of surgeries is like the difference between night and day as far as the patient is concerned.
قال لي ان هو في نوعين من التدخل الجراحي. الجراحه التقليديه القديمه فتحه كبيره جدا يفتحهم ويشيلوا الكاتاراكتا. النوع الحديث فيكو امالسيفيكيشن بيدخلوا زي سن دبوس صغير جدا في ثقب صغير جدا جدا مجهري وبيشفطهم او بيدوبوا الاول ده الكاتاراكت او المياه البيضاء وبعدين بيشفطها وبعدين بيزرعوا عدسه عن طريق حقن العدسه بتخش وبتنفتح داخل المحفظه بتاعت العدسه ويبتدي الشخص يعني يشوف طبيعي. The other very wrong information or misconception, can cataract come back after this operation, after phaco?
No, not really. Sometimes you will get a condition which needs to be treated by laser, but this depends on the way that the surgery is done. And again, using the right lens with phacoemulsification, the risk of this is lower than doing the surgery in the old way.
Yeah, and once it's done, it is done.
Once the cataract is removed, it is removed. Now, one thing I have to mention, to go back onto the question, is we were asking basically what is the difference between these two procedures. And as far as the patient is concerned, there are some very important differences. With phacoemulsification, there are no sutures, usually. I mean, the wound is so small, it closes by itself. So typically there are no sutures. The patient can go back to their normal activities the very next day.
Quality of life better?
Yeah, rakua, sujood, sports. I have had patients go back to weightlifting, tennis, golf the very next day or the very first week. The question we're asked most commonly here is men asking when they can go back to their wives, the very next day. So the return to a normal life is like this, as opposed to the older type of surgery where they have to wait 6 to 8 weeks, there are sutures to close the wound stays weak for the rest of their life, high astigmatism, risk of decreased vision, permanently decreased vision, and much higher risks to the patient as well.
كمان الحقيقه بيقول دكتور براون ان عمليه الفيكو او التقنيه الحديثه اللي هي عن طريق البروب الصغير او اللي بيخش ويفتت ويسحب الكاتاراكت انه ما فيش غرز، ما فيش قيود جراحيه، بيسمح للإنسان أن بيعود إلى حياته الطبيعية بعد فترة قصيرة جدا ومزاولة كل نشاطاته. في عنده ناس رجعوا حياتهم الطبيعية بيشتغلوا العمل والركوع والسجود والصلاة، حتى العودة إلى العلاقة الزوجية الخصوصية الحميمة بعد إجراء العملية تاني يوم ما فيش أي مشكلة خالص. فواضح أن هذه العملية لها تقنية عالية ومتميزة جدا عن العمليات القديمة. Another misconception, I have cataract, then I will be waiting until it becomes mature, testoey. Then I'll go to Dr. Abdullah Brown to have the operation. What do you think of this?
Well, it's each person's choice, but with the phacoemulsification, the surgery is so safe that we do the surgery on patients who have very, very little loss of vision. If the person wants to wait until they are blind to come in, they have to understand that they are taking a high risk.
Right.
By the time they wait that long, they can develop glaucoma. They can develop inflammation inside the eye. They can make many problems for themselves that by that point maybe we cannot fix anymore. So really it's better now to take care of the cataract early rather than late.
سألت سؤال الناس عندها اعتقاد خاطئ في مجتمعاتنا وبلادنا، يقول لك أنا استنى على الكاتاراكت لحد ما تستوي أو المية البيضاء تستوي وأجي أعمل العملية. قال الحقيقة طبعا ده اختيار الإنسان ولكنه لا ينصح بهذا الاختيار. لابد من التعامل مبكرا لأن ممكن الكاتاراكت يؤدي إلى جلوكوما، يؤدي والعياذ بالله إلى فقدان البصر ويؤدي إلى العمى. فلابد الإنسان اللي عنده كاتاراكت لابد أن يتعامل معه مبكرا عن طريق التدخل الجراحي اللي أشار إليه الدكتور عبدالله براون. Okay, sir.
Let me ask the question for a minute. You know why people used to wait so long?
Yes.
It's because they were afraid.
That's interesting.
Yeah, in the past, the quality of medicine was so poor, frankly speaking, was so poor, and the results from this older kind of surgery were so bad that they were afraid.
Mm-hmm.
And so now I just have to say that with this newer procedure, there's not the same risks. The results are so much better, and people can expect to go back to having excellent vision the next day. So the fear should be removed.
الخوف اللي كان بيمنع الناس، الخوف اللي كان بيخليهم مضاعفات او من العمليات القديمه، ولكن بعد التقدم الحقيقي في التكنولوجيا ما عادش الخوف ده موجود، ولازم اللي عنده كاتاراكت يعمله بسرعه. We'll take a quick commercial break and then we'll come back to talk. أعزائي المشاهدين، بناخد وقفة إعلانية قصيرة وبنرجع عشان نكمل حديثنا مع الدكتور عبدالله براون. فإلى اللقاء بعد الوقفة الإعلانية القصيرة.